Good afternoon. I am doing my discussion for, forgot where I'm at right this second. Pain discussion board video post. I have chosen to go with Cameron Frad. She is a blogger. She suffers from chronic pain. She has multiple diagnoses, which I will delve into that one. Question number one, how does the person describe their pain? She describes her pain as constant, never escaping. When she's in extreme pain, she does experience brain fog. She says it feels like her knees and hips are going to go out on her when she's walking, and she does not look as sick as she feels. That is a common problem that people with chronic pain do experience. What are the causes of her pain? She has EDS. Basically, that is where the joints of the person are overaccentuated. Their elbow would be bent back. She shows an example of that one. In addition to that, skin ages faster, has extra amount of skin, looser skin on the face and other areas. She also suffers from gastric issues, GERD, polycystic ovarian syndrome, and of course, chronic pain. The way that she copes with her pain, she stated that she went on vacation to Florida and that she felt a relief in her pain. When it's hotter, she definitely feels better. She's an Ohio native, so the colder climate does have an effect on her pain level. When she is in pain, she does push through it. Her doctor said that was one of the things that was detrimental to why she is the way she is now, was pushing through her pain and not taking time to rest her body. She does wear compression garments and restricts blood flow and food, which helps her lower her pain and associated issues, inflammatory process, as well as maintaining her blood pressure using the compression stockings. Do I believe that the person's pain is being well controlled? No. She seems to tolerate her pain very well on the outside, but seldom is she very pain-free. When she was in Florida, she mentioned that she was pain-free, but after going back to a colder environment, she was then faced with, within 2 days, she was right back to where she was with the pain. She didn't state what she took for pain as far as her pain management, as far as that goes. She made a reference to feeling like one big giant bruise. She also empathizes with her friend who has anxiety issues. One of the other things that people suffer from but aren't seen. A lot of times it is easier if we see a broken bone or a contusion or something of that nature to go, oh, well, that equals pain, versus what the person's actually feeling on the inside with, mental illness, chronic pain, the unseen things. She relates to many of her subscribers that are mothers, trying to be so many places at one time while dealing with your own burden. She relies heavily on her faith and makes reference to how she would gladly take and trade her illness for someone else's. Someone who has infertility, she would gladly take that versus being, what she has. Because of her faith, she definitely uses it as a way to not minimize her pain, but to help rationalize and help her cope with a coping mechanism. What could a nursing assistant do to assist with a patient like this? Empathize. Realize that there are things going on that you can't see. Have them use descriptive details to help you understand better what they're feeling. Ask them what they need. Does she need it warmer in the room? Does she need for you to elevate her bed, help her sit, help her stand? Her joints are affected. Just understanding where your patient is coming from can definitely make a big difference. Thanks.